All right, Commissioners, please stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Need a motion to adopt the agenda?
Move by
To adopt the agenda.
Second by Haw.
Very good. Please vote to approve the agenda. Thank you. And item number 4 is approval of the minutes. I need a motion to approve the minutes from June 10th, 2020 and July 8th, 2020.
Motion by Leonetti.
Support Carabelli.
Very good. Motion by Leonetti, supported by Commissioner Carabelli. Please vote. Motion passes. Item 5 is public participation. Is anyone from the public that wishes to be heard on any item on the agenda? You have 5 minutes to speak on any subject on the agenda. Please state your name and address for the record. Anyone on the line, you can press *6 and you can speak. I know we had one person that was trying to get in. I'm not sure if he wanted to speak under public participation. Yeah. One more time, anyone under public participation wish to be heard? Press *6 if you're on the line.
Sir, I was standing by for the interview for the Veterans Affairs Commission, sir. Over.
Okay, very good. All right, we'll stand by with you. Anyone else wish to be heard on any item on the agenda? Seeing none, we'll close public participation. Item 4 is item 6 is appointment interviews. We're gonna have an overview of the Veterans Services Commission by the director. So anyone that's on the line right now, if you could *6 your phone. All right, please go ahead and give an overview presentation of our directors here.
Who's he talking?
Hi there.
Hello.
This is Laura. Did you want me to speak now, or do you want the applicants to speak now?
No, we want to give you an overview. Over.
Chair Brown, Mike Salyers is available. He's a member of our Veterans Affairs Commission, and he will be providing the overview.
All right, very good. Go ahead, Mike.
Unmute Mike.
Mr. Salyers, you just need to unmute your.
No, Laura's waving her hands and yelling no, so I don't know what that's about.
I think she's indicating to Mike that he is not being heard by the rest of the group. And Mr. Salyers, you need to unmute your mic on your computer. If you put your cursor down toward the bottom of your screen, you will see.
Okay, how's that?
Yes, sir, you're on. Thank you.
Okay. How is everybody today?
Fine, thank you.
Hopefully you're doing good. My name is Mike Salyers. I'm on the Veterans Service Committee, and I wanted to tell you a little about our committee. Our committee hires and fires all the people in the Veterans Service Office. So we're not just there for the relief fund, but we're also there to do interviews and everything else that needs to be taken care of in the office. So we work directly with Laura Rios, who is the director, and we not only go to relief meetings, which is twice a month, we will meet and go over people's financials to figure out if they qualify for a grant. And so we do that. That's the Veterans Millage. It's part of the Macomb County Veterans Millage. So there's a lot more involved than just coming to those 2 meetings. There's interviews. Sometimes we go to other meetings, the board meetings and stuff like this. to actually explain what's going on and answer the board members to let them know what we're doing. If there's any other questions, they can ask me.
I don't have any questions. Our staff is going to be calling out the individuals per the committee. Crystal, are you prepared to do that?
Yes, I'm ready.
Please go ahead.
Okay, so for the Veterans Affairs Commission, there are 2 vacancies. Those are newly created positions. They are 4-year terms, but these first appointments are going to be partial terms, both beginning on October 1st of 2020. One will end on July 31st of 2022, and the other one on July 31st of 2023. The first applicant we have to speak is Norman Pfaff. Mr. Pfaff, are you there?
Yes, yes, I am.
Okay, if you could please introduce yourself to the commissioners, talk about the reason you applied, and if you have a term preference between the 2 terms I just mentioned, that would be helpful. And then Commissioner Brown can let you know if there are any questions from anybody.
Yeah. Well, I've been very active with the veterans, belong to both the Marine Corps League. I became up to department to commandant, and also involved with the American Legion, where I'm at this time, post 351, I'm not only the financial officer, but the VSO, service officer, and also the judge advocate. So I've been very active. Along with that, I'm also down at the VA hospital, where I take care of the VAVS for the Marine Corps League, and I also volunteer. You can call Bill Browning. I'm more or less called at the picnic and what they have a country store meet. I'm kind of called the hot dog man, because the Marine Corps League supplies hot dogs, buns, all that kind of stuff for the veterans at the hospital. We put that on at the summer picnic, and also the country store. I'm going to continue to do that throughout. Along with that, both we always joint with the Legion at Post 351 with the Marine Corps League, and we always put on a free to veterans picnic in the summertime. We also put on a free dinner at the Marine Corps Birthday Bowl November 10th, and at our Christmas party, we always invite members of the American Legion and the Marine Corps League. That's free to members. We feel that's giving back to the veterans. So along with that, that's pretty much primarily what it is. We also started 2 things with the American Legion and our Marine Corps League. We do what we call a buddy call, and we call every member. We try and make it monthly, bi-monthly type thing, every 60 days, to see how they're doing, their family's doing. Not so much to say come to a meeting, but how they're doing, and can we interact with them. We have a Marine Corps fund for members, also with the American Legion. We can help out through our VSO department. So doing the buddy calls is something we started, and a membership for the Marine Corps League. We got 100 and some members there, but we've increased our attendance to our meetings, by 15, 20 people. So we're getting up 25, 30 people at a meeting. Also, we do honor visits. So the senior veterans that are in both the Marine Corps League and our American Legion, and we go outside, because I do a lot with Bill Browning at the VA hospital. Do a lot of honor visits. These are veterans that are homebound. Maybe they can't get out. And this is a matter of picking up 4 or 5 guys, and a lot of times, sometimes myself, whoever's available, and we go see these veterans at their house or in their nursing home, wherever it might be, and that gives them a little upbeat. And again, like I said, regardless of what, that'll continue along with doing my jobs with the commission. If you'd like to do that. Anyways, that's all I have.
Thank you, Commissioner Romano.
Thanks, Chair. Norm, you were a military man. What branch of military service did you serve in?
Well, I served in the United States Marine Corps, 1959 to 1960.
And Norm, you mentioned this buddy call. Do you personally make these buddy calls, or you keep saying we do this and we do that? Are you personally involved in that? I mean, you actually making the buddy calls yourself?
Oh yes. In fact, what we do, we split the roster with the commander, senior vice, junior vice, is a lot of times sergeant arm. So we'll split it. So there'll be 4 or 5 of us making the calls, you know. But yes, I'm involved with the buddy calls and any of the honor visits too. Yes, sir.
Norm, it sounds like you have, and I'm just from what you're telling me, you have a full plate right now. Why would you want to add in something like what you're applying for, which is the appointment?
Well, I wasn't sure just what the appointment involved, but veterans and the veteran organizations have been dear to my heart, and I've been very active. I'm also a member of the Devil Dogs, Military Order of the Devil Dog. So this is only 2 days a month. I don't know how many hours a day it involves, whether it be an afternoon or 2 hours, but it's something that I think I could fit. Oh, and by the way, I'm also a member of the Macomb ritual team, and where we perform honors, funeral honors to veterans of any branch. And I joined that in February, and since February, we've done over 45 of the funerals in which I attended. Probably I took part in probably 30 of those. So how active you want to be. It's how active you think you want to be. But I don't think I'm all that active right now. I'm retired, so I got time to do a lot of this stuff.
Norm, I was in attendance at one of those military funerals just as recent as probably a week or 10 days ago. And I have to tell you, I was very impressed. The guys came out in uniform, very professional. It was a little heart-wrenching, but I want you to know, as an ex-military man myself, I appreciate what you guys do for us. That's all I have. Thank you, Chair. Thanks, Norm.
Okay, you're welcome.
Thank you, Commissioner Romano. Commissioner Kleinfeld.
Thank you, Chair. Norm, have you had any experience or interaction with our Veterans Department? And do you know what types of services we provide?
Well, Leah's came. I believe Laura came by our post, and she gave a summary of what she does, or what. So anytime a veteran, if we can't help them out at the post, if they're looking for benefits, the first thing we tell them to do, if you've got to get to the VA hospital, and if you're in the VA plan already, well, then you can go down and see Laura off at Dunham Road. And let them follow up on what really good for them to do.
Thank you very much.
Okay.
Thank you, Commissioner Chairman Smith. Chairman Smith, are you available? *6. Unmute. Oh, but he's no longer there. Thank you very much. We'll be making a vote at a future meeting. Norm, thank you for your service and your time today, and stand by.
Thank you.
Okay, next we have Joseph Reeker III. Mr. Reeker, are you there? If you're on the phone, you have to hit *6 to speak. Mr. Reeker? Okay, we'll move on to Joel Rutherford.
Good afternoon.
Hello, this is Joe Raker.
Oh, okay. I'll stand by.
My apologies for that. My name is
Go ahead,
Joe
Joseph.
Raker. Yes, good morning. Good morning, Chair. Or actually, good afternoon, Chair. Good afternoon, Commissioners. My name is Joe Raker. I am currently down in Gulfport, Mississippi, having some technical difficulties. We just dodged Hurricane Sally. So I've been recalled to active duty in support of the DoD operation against COVID-19. I'm the commanding officer of Expeditionary Combat Readiness Command down here in Gulfport, and our mission is to mobilize reservists. We were stood up in response to the negative impacts that COVID was having on mobilizing reservists to contingency and emergency operations globally. In my civilian capacity, I serve at the pleasure of the Harperwood City Council as their city manager. I've been down here on order since May, and these current orders will end in September, pending any potential extension. The reason why I wanted to get involved is through my public service, which has been pretty much my adult life. I've been on active duty, both enlisted as an officer, also in the reserve as enlisted and as an officer. And I met Mr. Pat Daniels back in about 2010 during an MLK event, and he came over and he placed a large medal around my neck. And I was surprised, and I said, "What is this for?" And he said, "Hey, I'm a Vietnam veteran, and we're making sure that you're welcomed home. I just came back from Afghanistan." He said, "And we're making sure that you're welcome home, that you received the welcome that we never received." And so that always stuck with me. While I was on the city commission in Mount Clemens, I met Mr. Mike Sand and Paul Palazzolo that were trying to make some inroads with the old Macomb Daily building to try and get veterans rehab services and some living quarters in there as well as a renewable use for that building. Unfortunately, that did not come to fruition. From there, I then crossed paths with them again when I was serving as a staff member for the city of Detroit, Detroit City Council, where I served on Council President Brenda Jones' Veterans Affairs and Military Task Force. While there, I spearheaded Detroit becoming a Purple Heart city. I championed the Purple Heart Truck Run, which was Ford Motor Company had outfitted a truck for amputees, and they demonstrated that mobility is life, basically, giving new mobility to veterans who had unfortunately became amputees during the service to their country. I also then, if you've been down to the KMAC building, the Coleman A. Young Municipal Center, on the first floor on the county side, there is a Veterans Tribute Wall. I worked with Detroit City Council and the Detroit Wayne Joint Building Authority, putting that display together, which features all the Medal of Honor recipients that passed through the halls of historic Fort Wayne, the relevance of historic Fort Wayne, and also the contributions of minority service units such as the Triple Nickel Paratroopers, the Buffalo Soldiers, the Tuskegee Airmen, and the Monthly Point Marines. Currently, I'm still involved with Council President Brenda Jones' Military Task Force, trying to bring a Fisher House, which functions much like a Ronald McDonald House. How Ronald McDonald House functions to parents with children who are undergoing various treatments. Fisher House functions for spouses and family members of veterans that would be receiving treatment, and that is an ongoing effort. Since I've left the city of Detroit back in 2016, I still had some involvement with that. And so during my conversations with Mr. Paul Palazzolo and Mike Sand, they had expressed like, "Hey, you young guys gotta get more involved. Okay, you know, we're in our 70s, and I need you guys to do more." And I've been blessed in my service. I've been in harm's way and thankfully come out unscathed. And I've realized that there's more that I can do and need to do. And so I offer up this my services and opportunity to serve Macomb County veterans. Pending your questions, that's all I have.
Thank you. Commissioners, Chairman Smith.
I'm not hearing Chairman Smith.
No, I'm not either. We'll go to Commissioner Haw.
Thank you, Chair. And Joe, as to all the veterans, thank you for your service. You indicated that you're still actively involved with the National Guard. Can I ask what rank you are?
I am in the Navy Reserve. I'm currently, I hold the rank of Commander 05. I have been selected for promotion to 06, which in the Navy is Captain, and I will put that on September 1st of next year.
And did I hear you say you're currently a city manager?
I am. I am the city manager in Harper Woods, Michigan.
Well, God bless you for that. That's all I have, Chair. Thank you.
Thank you, Commissioner Hall. Commissioner Romano.
Thanks, Chair. Joe, you mentioned the fact that you're on active duty, and I'm sure you're aware of you've looked into what the Veterans Affairs Commission actually does. Is there something that you personally would like to bring to the table for the Veterans Affairs Commission that you've thought about that they personally don't have right now? Is there something that you feel that very strongly about that maybe we should be doing that we're not doing now?
Sir, to be honest with you, I don't know much more than what was posted on the web as far as overseeing the Veteran Service Department and appointing its director. The gentleman that spoke first did provide some additional insight as to the duties and responsibilities. I thought that I would be pretty uniquely qualified, being the fact that I serve at the pleasure of a board. So I know what it's like to be, basically like the chief administrator reporting to a board. So I think that I would bring a good balance and perspective in regards from the board to director interaction.
Joe, you mentioned the fact that you've been activated. How many times have you been activated in the last 3 or 4 years?
In the last 3 or 4 years, this is the only time in the last 3 or 4 years. The other time that I was activated was 2009, 2010 for a tour to Afghanistan.
Okay, I was looking to see if you were going to if you could be available, and apparently you can be, because this is something that happens few and far between. As Mr. Haas said, I thank you for your service, and that's all the questions I have for you, Joe. Thank you so much.
Yes, sir.
Thank you. Chairman Smith, you're back on.
Myra Sauger.
Well, go ahead, Commissioner Sauger.
Yeah, Joe, it was nice hearing you. Stay healthy down there, and I look forward to you coming back here. Thank you, Joe.
Amen. Yes, Coach. Thank you. I'm glad to hear your voice, too.
Okay, thank you. Yeah, I coached Joe in grade school football.
All right.
Yes, you did.
Thank you, Joe.
Thank you, Commissioner Sauger. Chairman Smith. Chairman Smith, *6. You obviously know that. Must be a technical difficulty of some kind.
Chairman, maybe we can have one of the staff give Bob a call and tell him he's not coming through.
Yeah. They're on the line. Staff's listening. I'm sure they'll take care of that. Chris, we can go on to the next. Thank you very much for your time today, and we'll be stand by for a decision by the board. Thank you very much for your service.
Yes, sir.
Thank you.
Okay, next is Joel Rutherford.
Good afternoon, Chair. Good afternoon, Commissioners. I'm Joel Rutherford. I live in Warren. I'm retired Air Force. In fact, coming on this today, I've realized I've been retired from the Air Force longer than I was in the Air Force. So it's something to me that, I've also had a lot of contact because I retired 4 years ago out of Selfridge as a civilian Federal Service employee. And one of the things that we had was air traffic controllers that did training from Air National Guard units throughout the country, including Hawaii. So I'm very familiar with what Veteran Services does because we did a lot of referrals to them. And I have to say that Ms. Rios and her staff certainly provides outstanding services when it comes to healthcare, education, burial services, or homelessness. The reason why that I wanted to join the commission is because one of the things that I believe in is outreach, especially to disadvantaged communities that aren't as represented in Macomb County that, need that information. It's something that I do now, try to make sure that people get that information on where the services are available. I work on a board from a 501c3 now in Ypsilanti, my hometown, and it involves things as far as budgeting, hiring, and firing of employees, basically the same things that the commission's involved in. Since I am retired, I feel like I'm a fortunate veteran, military, into a civilian career, have something, but I know how many that haven't. While I was active duty, I had a barracks mate that, went through some difficulties and unfortunately came home from work, went on the top of the building and jumped off. And it was something that stuck with me for that entire time. There was just, to me, it was so sad, but it was also because he felt like he just didn't know where to go, apparently. And it was something that I see that with veterans now. I think that's something that's going to be ongoing for decades because of the amount of time we've been in combat. So that's one of the biggest reasons for me that I'd like to join the commission. I have the time. And most of all, my experience is varied enough that I'm able to see things from a lot of different perspectives, but also be able to work with anybody. And I'll take any questions now. Thank you.
Thank you. Commissioner Kleinfeld.
Thank you, Chair. He answered most of my questions. I was just wondering, Joel, if you had had any personal interaction with our Veteran Affairs Department, or if you've used them.
I haven't used them. Like I said, we've recommended a number of guard people there. I know some of my former co-workers out at Selfridge have used them, and that's why I'm familiar with the outstanding work that they do.
Thank you.
Thank you.
Chairman or Commissioner Haw.
Thank you, Chair. Hi, Joel. In the relationship with the individuals that you know that have dealt with Fair Commission in the past, have they given you any assessment of how they were treated, how quickly they responded, and what issues were resolved?
Commissioner Hall, the people that I've recommended as far as them use veteran services have always had, outstanding comments. They said that, they felt like they've been treated fairly. Things have gone extremely well, that, people have stepped above and beyond what they expected. Like I said, I certainly have no criticism whatsoever of that. I just look at it as I would like to do more outreach in areas that sometimes people feel like maybe haven't had enough contact or had enough interaction as far as, to know exactly what resources are available.
Thank you, Joe. Thank you, Chairman.
Thank you.
Thank you, Commissioner. Chairman Smith is on the line. Mr. Chairman, you can go ahead when you're ready. I will hold on him and go to Commissioner Romano.
Man.
I think
Bob, are you there now?
I am here. I just don't know what's been going on, but
I don't know.
Sorry.
Okay, well, go ahead.
I keep trying.
You're on.
Thank you. I will tell you that most of the questions that I was going to ask that I've of all the applicants have been asked already by the time you got to me. So we really didn't miss anything. And Mr. Rutherford just came to the question that I was going to ask. What does he see as probably his biggest attribute and what's needed most that he knows of with the Veterans Committee? And he just said that finding new ways to reach people that haven't been reached. And he thinks that he, has a niche for maybe doing something like that. And I think the same thing, that's the hardest part of being on that committee, is finding people that don't know that there are services available and trying to figure out how to get to those people. So he answered my question. I just want to make sure I was actually back on the meeting. So thank you, Chair.
Thank you, Mr. Chairman. I'm sorry for the difficulties you had.
It's on my fault. It's on my side, I'm sure.
I'm sure it's a combination of things. Commissioner Romano.
Thank you, Chair. Hi, Joel.
Good afternoon.
Joel, good afternoon. You brought something to my attention, and knowing that these veterans that you have sent to the VA for the different difficulties, was there anything that stood out in your mind that was common with most of them, if not all of them, that you feel that maybe something could be tweaked or brought better to a better understanding between the veterans and the Veterans Administration? Something that you felt when they came to you with their problems that you said, I think there's something that we can do about that, or there's something that the veterans doesn't take care of? There's something that sticks in your mind when you were talking to these people and referring them to the VA?
Commissioner, the thing that stuck in my mind, and these were people, in Black, Brown, and other communities of color, was, getting past the pride. Because for so many that pride was in the way of them actually seeking out help. And it didn't matter in what area it was, but too oftentimes it was just saying, look, if you need help, it's available here. Just contact people. That's what they're there for. And I think a lot of times that was, the biggest issue was just sometimes pride and also sometimes trust, because anytime you talk about government agencies, for some people, and, even veterans, those of us that have served, still kind of look at government agencies, somewhat hesitantly. So I think that was the biggest issue. It wasn't so much a problem from the Veterans Commission side or, services side. It was just doing that outreach to people to say, hey, these are people that are there to help you. Please take advantage of those, of those resources that are available.
And I think you're absolutely right. I've heard that time and time again from veterans saying, I don't need any help. I can do this on my own, because pride gets in their way instead of common sense. But after what they've been through, especially those that are actually active and served in Vietnam and wartime, I can understand where they're coming from. While they're in service, they handle it by themselves, and they have their buddies to deal with who are no longer with them. So I can understand what pride would be a big factor involved. Thank you, Joel. I appreciate it. Thank you, Chair. And Joel, thank you for the service.
Thank you, sir.
Thank you, Commissioner Romano. No other questions for you right now, Joel. So thank you for your service and your time today. We appreciate your feedback and input and what you see as a vision for you on that position. And stand by. Crystal, who's next?
Next is Terry Weston.
Hello, Commissioners and Chairman. How are you?
Fine, Mr. Weston. Please proceed.
The reason why I think I bring something unique is I'm recently retired as of 23 months ago. I did serve in combat, and I think being a female war veteran of Iraq brings something unique to the table. I am currently not working, and I'm not looking for a job. I'm unemployed and want to donate my time and efforts to my veterans. I do belong to the VFW Executive Board in St. Clair Shores, and I'm super proactive in the Anchor Bay Chamber of Commerce. I live in Chesterfield Township, and I really think with the population in Chesterfield being so close to Selfridge that I could bring something super unique with me being as detail-oriented as I am. I just ran a trustee position in Chesterfield. I missed it by 10 votes. I'm used to reaching out to people and going door to door, and I'm available 24/7. So I think that's what I bring to the table. Thank you.
Thank you. Commissioner Kleinfeld.
Thank you, Chair. Just curious, I was looking at the work that you did in the military. What was your rank when you left the military?
Ma'am, I had a break in service. I did 6 years active duty Army, had a 5-year break in service. So I had to start over from scratch pretty much. I got out as an E6 Petty Officer First Class, but I held capacities and leadership roles of that of an E7 and E8 while I was in.
Thank you. I just want you to know I'm not judging when I asked that question. I just thought that your experience was interesting. And my second question is, do you have any, have you had any interaction with our Veterans Department?
I've had personal interactions with the VSO department with Miss Laura Rios and her staff. I filed a claim through them and they were fantastic, but I have not had any interaction with me being newly retired. I haven't had any reaction with the Macomb County Department as of yet, but I'm looking to dive deep into it.
Thank you.
I don't have any other speakers. Thank you, Ms. Watson, for coming in today. And as with the others, we thank you for your service and your time to come in today and offer yourself to the veteran population. And we'll be in touch with you soon. So thank you very much.
Thank you.
Thank you.
Hey, Don, Chair.
Yes, Commissioner. Yes.
Did you let them know? I'm sorry, I'm still having some difficulty. Did you let them know that the vote will be on full board? And we'll be
having a full board meeting will be
and what
have a vote.
Okay. So they can all join us on that meeting also if they'd like to.
Absolutely. The staff will let them know that as well. So we'll make sure that they've got that schedule straight.
All right. Thanks, Don.
Thank you. Need a motion to receive and file the interviews.
Moved by Kleinfeld.
Board support, Carabelli.
Thank you very much. Please vote. Very good. Thank you very much. Next item is number 6C, overview of the Substance Use Disorder Oversight Policy Board. And we're going to have an overview of that subject matter as well. Crystal?
Yes, Helen Klingert is here. She's going to give that overview.
Thank you very much. Thank you, Helen, for coming in today. We appreciate your time today.
Thank you. Yeah, I'm glad to be here today. I'm the Director of Substance Use Services within Macomb County Community Mental Health. Our department is responsible for the funding related to substance use prevention, treatment, and recovery services. We provide that for Macomb County residents who have Medicaid, Healthy Michigan, My HealthLink insurance, or for people who are uninsured or underinsured and low income. So we provide many different services, and we have an oversight policy board that helps with many of the things that we do for our decision-making process. So the role of the oversight policy board is to act and approve the portion of our substance use budgets that include any local funds. So they are the entity responsible for that. In their other capacity, they work to advise and recommend many different things to our Macomb County Community Mental Health board. So in that role, they would advise and recommend on issues such as all other budget items, such as Medicaid and state and federal dollars that we receive. So those budgets, contracts for substance use services, our goals and priorities for the continuum of care, as well as give advice and recommendations related to our annual plan of service. So that is just a brief overview of our department and the board. The board generally meets once a month. Members participate with us currently, just like you are, virtually for our meetings during this COVID period.
Very good. Thank you. I've got a question. How involved are you with the opioid epidemic and the funding stream coming in to help combat that crisis going on with us right now?
We are very largely involved with that. That is one of our primary problems that we see for the people that we serve right now. The primary substance of use coming in for admissions is opioid related. So we do receive our general regular funds through Medicaid and block grant dollars from the state for treatment services, prevention, and recovery. But we've also been awarded for the past several years some additional funds from the federal government that come down through the state for the state opioid response initiatives. So we're just finishing up a 2-year cycle on that, where some special programming had occurred. And we're going to enter into the next phase because the government issued another 2-year funding cycle. So we've received about $2 million extra a year over the last couple of years, and will again to help address these issues more thoroughly.
Well, you've got a little homework. Well, I'd like to request to the executive that I'll come back and give us a report on the efforts on that subject, because it's getting a lot of attention and a lot of research is going to it, and I'd like to see the progress that we're making. So thank you very much. Crystal, you have some candidates for us to proceed. Thank you very much for your time and overview, and we'll be in touch with you on other subjects, all right?
That sounds good. Thank you.
Thank you.
Yes, we have 2 vacancies and there are 2 applicants. These are both full 3-year terms. The first one on the list is Katie Donovan. Ms. Donovan, are you there?
Yes, I am. Thank you so much. You can hear me okay?
Yeah, please go right ahead.
Okay, wonderful. Thank you. And thank you so much, commissioners. Yes, my name is Katie Donovan. I'm actually applying for reappointment for this particular board. It has been an absolute honor to serve for the past 3 years. I personally am a mother of someone who has struggled on and off with a variety of substances for about 12 years. And after many years of not knowing what to do or where to go, I ended up leaving my very successful corporate career to devote my life to this. Currently, I am a writer. I've been in USA Today, Time Magazine, Money Magazine. I also have a national column called Shift Happens, which is underwritten by Hazelden and Betty Ford, as well as an award-winning international blog all of which is devoted to addiction, people that are struggling, but primarily the focus on the families that are affected, because personally I felt that was a piece that had been really missing, because this really is a family disease that truly affects everyone. I'm also a family recovery coach, which is someone that is focused, again, just on the family dynamics and helping them heal through the pain and the process of this. I'm also a national speaker, so I speak all over the nation, different events and conferences. And with that, I'm able to network and really bring creative and innovative ideas and best evidence-based practices that are happening across different states to Macomb County. One of which I was one of the leading forces behind the creation of Hope Not Handcuffs, which I left about a year ago, but primarily because it was really becoming a full-time volunteer thing. And I've also, in partnership with Macomb Medical Control Authority, MedStar, and the Sheriff's Department for an outreach program where they go to someone's home after an overdose and help provide them resources, treatment options, or again, sitting with the family and helping them. I also sit on currently on the board of Unite to Face Addiction Michigan and Brighton Center of Recovery. Thank you so much. If there are any questions.
Thank you. Thank you for your answers. Commissioners, Commissioner Hawk.
Thank you, Chair. Katie, let me say thank you very much for everything that you do. I have been to a couple of the Hope Without Handcuffs graduations, and it is just heartwarming to see the success of those. My question is, have you worked with former Judge Linda Davis, Family Against Narcotics at all?
Yes, I'm actually the former Executive Vice President of Families Against Narcotics.
Wow, congratulations on that as well. That's all I have.
Thank you.
Thank you, Commissioner Hawk. Commissioner Romano.
Thank you, Chair. Hi, Katie.
Hi.
You know, you mentioned something, and I guess you can never, ever emphasize it enough, that the sympathy is always out there for the user, but sometimes people forget about the families. And I'm sure that each and every one of us knows someone, maybe not in our immediate family, but somebody that we know, friend, worker, whatever, that has somebody that is a substance abuser. But not enough concern is put onto the families, because the families are the ones the users know they're users and they're suffering, but the families who hope that they can contain this are the ones that really suffer. So I commend you for keeping that in your foremost in your thought and in your work that you're doing. Thank you so much.
Thank you so much. Thank you.
Commissioner Brown, are there any other questions from commissioners?
I see no other questions.
Okay, I did want to clarify that Katie is applying specifically for the position that is for a family member. And then our next applicant, Nancy Buell, she's applying specifically for the MISD position. And I'll let Nancy go now.
Thank you. Thank you, commissioners and chair. My name is Nancy Buell. I currently am in my 23rd year at the Macomb Intermediate School District, serving the role of school safety and student assistance consultant, which basically 20-second elevator speech. I do everything that is not related to math, science, social studies, but directly impacts how well our kids do in those subject areas. So I support our substance use prevention agencies, the Care of Southeastern Michigan, Macomb Family Services, Access, the Highway Traffic Association, as well as the county's youth substance use prevention coalitions. I'll do whatever I can do to help bring resource and consultation, technical assistance to those entities, as well as support the schools when they have needs and help them network. And I help to leverage some of our county resources in those areas, as well as suicide prevention, bullying, mental health promotion, all of those other very important topics. I am applying. This is going to be my third term. I think by law, there has to be a school representative on the Oversight Policy Board. And so that would be the role I would be filling. And I would be honored to continue in that role. This would be, as I said, the third term there. So I don't know if you have any questions.
Yes, we do. Thank you very much. Commissioner Kleinfeld.
Thank you, Chair. First of all, I had to turn my camera back on because we're dressed the same. I wanted to ask, we don't talk about this issue like we did a few years ago. We talked about it a lot a few years ago. And I was just wondering, how are we doing compared to back then? And how is COVID affecting this issue? Is it having a negative effect or a positive, or do we not know? Thank you.
You're welcome. So specifically related to youth or the substance use in general?
I was thinking substance use.
So I think certainly with the time of COVID right now, we're going to find out that data is going to probably trail, but you're starting to hear some rumblings as far as increase in substance use, alcohol, and even I have heard lately with increase in prescription medications and opioids in particular, which I know everybody is concerned about. And then specifically related to the youth in the schools, I know that is something that we've been paying attention to and talking about, especially since the students are all remote. How are we going to have those great agencies push in and continue to help build skills that our kids are going to need in order to be able to say no to substances? And so all of those agencies I mentioned in the beginning have come together, and the ISD has supported that with a letter out to our curriculum directors to show that we can still virtually and remotely push into the schools to provide that important education to our kids. And I also serve on the executive committee of what used to be called Operation RX, but is now MPOP. It's the Macomb Prescription Overdose Prevention Group that is specifically targeted to try to reduce the incidence of opioid overdose and death. So I know in Macomb County, we have been working hard, and COVID has sort of slowed that down a little bit, but that doesn't mean that all of these folks are not continuing to meet remotely and to talk about our next steps. We're currently working on a strategic plan and upping that strategic plan for the opioid specific strategies that we're trying to push out into the county.
Thank you.
Thank you, Commissioner Kleinfeld. Commissioner Kraft.
Thank you, Mr. Chair. Hi, Nancy. You serve with my buddy Dave Barron on the No Resolve board. I was wondering if you could update this body on what No Resolve is and kind of, what your role is on the board there.
Yes, I am the vice president. Dave Barron is the president of the board at No Resolve, and that is a mental health, a promotion and suicide prevention organization that is committed to helping youth remain mentally healthy and hopefully to avoid the incidence of suicide attempts and or completions. We currently have just opened up a brick and mortar building within the past year and a half, maybe, at 23 in Shaner, and that's called The Shed. And that is a youth-driven space that's modeled after the Neutral Zone in Ann Arbor. We pulled together a group of teens who decided the name. So it'll be interesting, hopefully, for you to hear that what they had decided SHED should stand for is Stimulating Humanistic Existential Development. The SHED is a place for those youth to come and connect, confide, and just be together to share their talents in an effort to help build their skills to remain mentally healthy. So it's been an honor to be on that board, and I've worked with the founder, Dennis Ligio, for many years as he's in the schools trying to do suicide prevention, and he has been very open to the guidance that the MISD might have for how best to support our youth in that area. Another passion of mine.
One more question along those lines. So because of COVID, the brick and mortar building. Has that been opened at all during this time? Is it still closed? Have you been working virtually? Okay.
Yeah, it's still closed. We just had a board meeting yesterday in which the decision was made, again, to model ourselves after the neutral zone. They remain closed. We have still our active Zoom meetings with the teens. And we, over the time of COVID, the youth wanted to try to stay engaged to the extent possible, and so they did like a little talent show, and a bunch of kids from the community joined to sing or read poetry or show their art and so forth. So there is still programming going on in a very limited way. We're building the plans for how to reopen that in a safe and healthy way, hopefully soon.
Thank you, Nancy. Thanks for all you do. Thank you, Mr. Chair.
Thank you.
You're welcome, Commissioner Kraft. And I see no other speakers, Nancy. Thank you for the detailed information you provided to the questions, and we'll officially fill this position at the next full board meeting. So thank you very much for your time. Commissioners, I need a motion to receive and file these interviews.
So move, Hall.
Support, Carabelli.
Thank you very much. Please vote. Very good. Thank you. That motion passes. Thank you very much. Substance Use Disorder Oversight Policy Board. Just did that one. Proclamations, 7A. Proclamation honoring Julie Bovishin, the Rising Star Award for Michigan Court Administrators Association. I need a motion on that.
Motion to approve.
Moved by supported by Commissioner Leonetti. Any discussion on that? Seeing none, please vote. That proclamation passes. Item 8 is new business. Any new business for the committee? Anyone have any new business? Seeing none, anyone from the public wish to be heard? Anyone from the public wish to be heard on any item? Doesn't have to be on the agenda. Any item that you wish to speak on. One more time. Anyone from the public wish to be heard? Staff, is there anyone on the line that wishes to be heard? I hear none. I need a motion to adjourn. Moved by Commissioner Gillette, supported by Commissioner Duje. Please vote. Very good. Motion to adjourn passes. Next meeting starts at 3 o'clock. Thank you, and I'll talk to you all soon. Stand by.